So with the PURE study, we examined the association between total fruit, vegetable, and legume intake and the risk of cardiovascular disease and mortality. We found that higher total fruit, vegetable, and legume intake is associated with a reduced risk of cardiovascular and total mortality. We examined vegetables intake for both raw and cooked vegetables separately, and we found that raw vegetable intake is strongly associated with a reduced risk of death, whereas cooked vegetable intake had a more modest benefit.
What we found globally, higher fat consumption reduced risk of mortality. Those who had 35%, about 35% energy from total fat had 23% lower risk of death. In contrast, people who consume a very high carbohydrate diet, around 68% or more, had 28% higher risk of death.
So what we found is that the higher the fat intake, total fat intake, the lower the risk of mortality. And this was true for both for total fat and individual types of fat, including saturated fat. The current recommendations state that we should consume less than 10% of our energy from saturated fat. We found that lowering saturated fat to currently recommended levels is associated with increased risk of mortality.
We are questioning the current dietary guidelines, and the reason is dietary guidelines are mainly based on studies conducted in Europe and North America. And PURE study is the first study which gathered information from low, middle, and high-income countries. Therefore, in the light of present finding, we are suggesting change on dietary guidelines.